Well, bisphosphonates are part of the standard of care for breast cancer patients with bone metastases. The reason for this is that it has been demonstrated that particularly potent IV bisphosphonates help prevent or delay bone metastases, but also skeletal-related events, as we call it. This includes episodes of pain, but also fracture, the necessity for radiotherapy or even surgery. And via these mechanisms, bisphosphonates are very important also to stabilize and optimize the quality of life of our breast cancer patients with bone metastases. Bisphosphonates have been demonstrated in preclinical work to have anti-cancer properties via a variety of mechanisms, both direct anti-tumor activities, but also indirect impacts on tumor angiogenesis and stimulation of the immune system. Now, emerging evidence from some of the more recent trials demonstrates that obviously they also can favorably affect the microenvironment in which dormant tumor cells, which for most of us are the source of late relapse in early breast cancer, survive. And these trials have demonstrated that adding bisphosphonates at a bone protection dose will actually increase the disease-free survival by reducing the probability of these patients to suffer metastases, both inside bony metastases, but also metastases at other sites, which is very exciting. We don't understand as of yet everything about this, but we have now several pieces of evidence indicating that this could be a very important treatment strategy in the future. There are basically two benefits. First, most endocrine therapies have some side effects, and this affects bone health. And bisphosphonates can help, and that has been shown now several times, that can stabilize the bone health of our patients, basically taking out these negative side effects of our very effective anti-cancer treatments, endocrine treatments, particularly aromatase inhibitors. In addition, we have now several studies showing that bisphosphonates may also exert anti-cancer activities. So in addition to this quality of life protecting properties of these agents, they may also themselves help our patients to remain healthy and to keep the cancer away, to put it in simple words, which is a very exciting perspective. Denosumab is a very promising molecule. It's an antibody against a very specific protein, the so-called rank ligand. And there are now studies showing that it is at least equally or maybe even a little bit more effective in preventing skeletal-related events. This is very early. We don't know everything about the antibody. And it may have the potential also to do what bisphosphonates have been shown to do. However, for example, for the anti-tumor effect, so far we don't have any data. I'm involved in clinical research with the molecule, and it could be great also against the tumor. But for now, we have to remain cautious because it's just a limited amount of information available at this point.